So what is auditory processing? Here we have, this is the back of the head. Here we have the cochlea, right? And we have it in both sides. And the sound is here, and now it needs to travel with our left ear, taking the information and traveling along the pathway and being delivered to the right auditory cortex. The same thing is happening on the right side, only in reverse. It goes, not reverse, but opposite. It goes in from the eighth cranial nerve, and it goes on the pathway up to the left auditory cortex. These areas that are marked are sort of that, the way I think of it is the transition points. And at each one of those points, that signal that's coming in as speech sounds is being transferred almost like a relay race. And it gets up to the cortexes. If the child has delay or distortion anywhere along this pathway, either in one pathway or in both pathways, they are going to be diagnosed with an auditory processing disorder because the audiologist tests for this. The audiologist also tests for what happens next. The right information, the information in the right auditory cortex, has to be shared with the left auditory cortex. And the left has to be shared with the right. And this happens across the corpus callosum. And so the rapidity and the evenness of that sharing of information is also what the audiologist is testing for. And they're looking there for binaural, 2 ears, integration. So anywhere along this trajectory from the right and the left ears, and if the right and the left ears are doing this in unison versus one ear lagging behind or the other ear lagging behind, all of those things are going to be diagnosed as an auditory processing disorder. Okay, now what happens? Thinking about that, usually from the left ear going to the right auditory cortex are the beats, the onset and offset of the beats, the prosody and the intonation. And from the right ear to the left auditory cortex in most people, especially right-handed people, is more of the language place. And usually that's going to be stored in the left auditory cortex. Okay. So we have completed hearing, processing of auditory information, and now we have to think about language. How does that information, which is sound-based, right? And if we wanted to think about it as speech sound-based, how is that processed and now turned into language? Okay. So looking at this cute little diagram of I'm going to be telling you a story about a child that was supposed to be hearing or listening to the word cap, k-a-p. It came in as cap, got distorted auditory processing, and what they heard and decided they had heard was cat. And what happens to information if that happens to the child? The next one is temporal processing, and we're really going to be looking at temporal processing as we see how it affects these. Remember, we're going bottom up right now. Temporal processing first is pitch pattern. All right, so this is the test. The teacher said, the audiometer goes beep, beep, beep. And the person being tested has to say high, high, low. What are they saying? I can hear the differences between those sounds. These two are both high and this one is low. And of course, there's a variety of sounds. But what does a person have to be doing in order to do that? They have to first hear it, goes up the pathways, And then if we're expecting them to label it, the information that came, the beeps that came to the right hemisphere have to transfer over the corpus callosum and then be turned into language where we say high, high, low. So if the child can't do that, but they can do the next thing the audiologist will do, beep, 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 just hum it back to me, and they can go, then what they can't do is called interhemispheric transfer. They can't transfer the beats to the labels. Important information for us, but that's what that is. But if they can hum, then they are telling us they hear the difference in the pitches. If they can't do that, then we have the kid that's going to have difficulty with nice sweater, nice sweater, hearing the difference in that and a lot more. Gap detection, another very important one for us, which has to do with compressed speech. It has to do with hearing the gap between syllables, between words, right? The child that hears everything mushed together. It's too fast. It's too fast. You're talking too fast. It's because, very professional word, it gets mushed together, right? No. And then the gap detection has to do with onset and offset. When a sound starts and when it finishes, and then there's a gap between the next one. That can be, again, the syllable, the words, and then the stress of it, the word content or content, right? Or sentence stress, the boy walked down the street versus the boy walked down the street, is pitch pattern. So within this temporal processing, we have so many things that can affect the things above. So we'll be coming back to that in a strong way. Auditory closure. The audiologist gives the child a word or a sentence. In the word, a sound drops out. Can the child close it? And a sentence, can they close it? If they miss it, are they gone? They can't make sense of it. Or can they fill in? And we are filling in. You're not hearing every single word and every single sound I say. So you're filling in, filling in, filling in. I call it the guesstimation, right? But for the children that truly can't do that, and because this is such a linguistic activity, actually, not just an auditory, I want to know if that filtered speech and causing them to have to close it is because they don't know how to fill in, auditory closure, or they don't know the word that they need to close, vocabulary. So I'm constantly looking at those. And here I'm going to employ the hand cue. So for me, the hand cue is when I'm talking, my hand is here, indicating it's my turn to speak. When my hand is here, I am inviting the student to now respond. And in this case, repeat what I have said. So it can either be used for my turn, your turn in a conversation or in a question answer, signaling the child with what? That temporal information. I'm done. It's your turn. Or in this case, it can be, I say it, you say it. I say it, you say it. And we're going to see this when we talk about exact listening. Exact listening is a form of reauditorization. I say a chunk, and the child repeats it back. If I were working for comprehension, I would not do this kind of activity. This activity comes before comprehension. Again, detection, discrimination, identification. The identification is when they say it back to me and they say it back to me correctly. And then we can work on comprehension. And we'll see this in a story when we start working through a story using all of these techniques.